I'm Dr. Mac, and this is 5 Minutes with Mac. Thank you for watching today. So, today we are talking about ear infections, particularly with children, because I have a lot of people coming in with kids that have these recurrent ear infections that are really annoying. So, some things to think about when your kid has an ear infection, some symptoms, because if they're really, really young, you might not necessarily know. So, if they're touching their ear a lot or pulling on their ear, if it seems like they can't hear very well on one side, if they're running a fever or have a lot of drainage going on, these are a lot of symptoms that happen with ear infections. So, some statistics. 5 out of 6 kids will have one ear infection before the age of 3. That's pretty much everybody. So dealing with that is a big deal because not only do you have to miss work if your kids have to miss school, but then your kids are miserable too, and nobody likes miserable kids. Over $3 billion are spent each year in the US on ear infections between doctor bills and different prescriptions, which I'll jump down here with the prescriptions. 15% of the bacteria that cause ear infections are resistant to the primary antibiotics, so the first choice of antibiotics that doctors recommend. Right now, when kids have an ear infection, a lot of times the doctors will either say, wait it out and see how it does, or they'll just give them an antibiotic. I've had kids come in who have been on 5, 6, 7 different courses of antibiotics to try to get rid of an ear infection. So 8.7 million people under the age of 18 are seen for ear infections in 2009. And 30 to 40% of kids who have ear infections will have recurrent episodes. So it's not like they just have one ear infection. A lot of times they'll keep coming back and back and back. So why is it that kids get ear infections so much? Well, we're going to look at the anatomy today, and I'll be able to show you a large part of why this happens. So, this is the ear of a child, and this is the ear of the adult. The ear canal here, which is where a lot of the problems happen. As you can see in the child, it's pretty horizontal, so it doesn't drain very well. So it's shorter, it's more horizontal, and overall, it's smaller than in an adult. So the fluid gets stuck in here, which then causes bacteria to build up, which then causes a lot of the ear problems and infections. When we go to the adult here, you can see it's a lot more vertical. So the fluid that gets accumulating in here, the ear canal or eustachian tube, it's able to drain out better through the lymphatic system. So with the ear infections, with children with it being more horizontal, anything in their neck can really put a kink on that. So I'll bring my handy dandy spine here, who I'm going to name Bob for today. You have lymphatic systems going all throughout your neck, which drain your ears, your nose, all your sinuses through there. Anytime you have mucus buildup, it's going to drain through there. So, if this bone is out of place, it puts pressure on that already small tube, so things can't drain as well. In addition, if your child has a really tight muscle, that can decrease the flow of the lymph that goes through there. So a lot of issues happen with children due to that, because if the bone's out of place, not only does it affect the nerves that control the muscles through here, but it can put a crimp on that passage that goes through the ear all the way down into the neck. So with chiropractic, what we do is we want to try to take away as much of the interference as possible. We want to get the bones in the right place so that they're not putting pressure on anything. Because with kids, there's not a lot of room up there. Their muscles and bones and lymph system, it's all in a really tiny area. So by adjusting that, it helps. One study shows that after 6 months of chiropractic care, 80% of the kids had no reoccurrence. And there were 332 kids in this study, so that's a sizable study. In addition, most of the fluid levels were resolved in 4 to 7 days in these kids. So it was a pretty quick fix for their ear infections, which is great for parents and kids alike. So, to summarize all of this up, lots of kids have ear infections because their eustachian tube is different than an adult's. It's shorter, more horizontal, and isn't able to drain as well. Chiropractic care can help with that, by moving things and getting the fluid able to flow better. And this is 5 Minutes with Mac. Thank you for listening. And if you have any questions, please contact me at drmcquilkin.stoutchiropractic@gmail.com. Thank you.